appreciated too. So this is amazing. This many people are here. You must be getting a little bump in your paycheck or something, because I can't imagine. I've heard me speak, and I wouldn't give up time to come and hear me talk. Also, greetings to those of you from the remote locations, and very happy that you're joining us as well, and we'll try to include you in all the conversation. However, the ones here in Des Moines are getting free prime rib lunches at locations. So sorry that you couldn't share that with us. Well, that'll make them want to come next time. It is, I know, a distraction. We have a lot of press people here, and I hope it doesn't bother you. Frankly, it sure doesn't bother me. It's kind of nice to see these guys getting interested after 11 months on the road when, frankly, we didn't have this many people coming to our events, much less press people. But I want to focus primarily my remarks on the issue of health and health care. And then when we do the question and answer, we can open up to anything you want to talk about. You can ask anything. I may not answer it, but you can ask anything you want to. That's how politics is actually working. Q&A, questions, avoidance. That's the way it works. First of all, one of the reasons that it's very, very significant that I have the opportunity to be here is because Principal is a company that has been a real pace setter and trend maker when it comes to health policy for employees. I was able to go and do a little walkthrough of your wellness center. Incredibly impressive. And even more impressive was not the fact that you had machines. A lot of companies have the facility. Well, what is impressive is your employees are using the facility. And it makes perhaps a lot of sense as to why that this company is considered one of the top 50 companies for workers over 50 in the entire nation, and AARP is recognized as one of the greatest places to work. A number of other organizations consider it a superior place, and always when best places to work are mentioned in surveys, whether it's Fortune 500 or others, the Principal always ends up on that list. I can get a better picture of why that is. So I wanted to say that if this quest for a job that I'm on doesn't turn out, I might be looking at a here. Since I'm over 50, and I'll be looking for work if this other thing doesn't work out. As Jim mentioned in the introduction, the reason that health policy is important to me is both from a policy perspective but also a personal one. From the policy perspective, there's no governor in America that doesn't have to deal with the fact that health care costs are spiraling twice the rate of inflation, and they're unsustainable. The fact is we spend more money on health care in terms of our total picture of the GDP than we do anything. Think about this. We spend almost 17% of our gross domestic product on health care in this country. And to put that in perspective, we only spend 3.8% of our GDP on military. So more than 4 times the cost of military, including the war in Iraq, is actually being spent on the war against disease, and we're losing the war. By 2015, that 17% will become more like 20%. And to put it in perspective even more, no other nation on earth spends that kind of money. Switzerland is about 10.5%. Most European nations are in the single digits. And if we were spending 11 instead of the 17, the savings every year in this country would be something like $700 billion a year. So it now has become the #1 economic issue, as well as just a health issue. A lot of people will talk about that we have a health care crisis in America. I beg to differ. It is not a health care crisis, it is a health crisis. And the health crisis is what's driving the health care system into bankruptcy. Spiraling out of control, because what we really have is an America that looks a whole lot like an NFL football game on a Sunday afternoon. 22 people down on the field in desperate need of rest. 70,000 people up in the stands in desperate need of exercise. Therein is sort of a classic picture of what's going on here. You were a little slow on the uptake on that, but thank you. You did dial in the frequency at some point. From the standpoint of a speaker, that's always helpful. There's nothing worse than laying one out there and nothing but silence. It's okay, I'm used to that too. I've spoken in a lot of situations. I want to now talk about, though, what's wrong with the healthcare system. First of all, the healthcare system is not a system. That's part of the problem. It's a healthcare maze. If it were a system, we would have an equal focus on access, affordability, and quality, and we don't. What we have is a system that has essentially been created in a disjointed way in a post-World War II model when people had their health coverage by way of their employers exclusively. And the employer, because of the tax laws that surrounded it, were really the owners of the health care and granted it as a favor to employees. In those days, it worked pretty well because most people went to work for a company. They continued to work at that company through their career, and 40 years later, they retired, they got a nice watch, a pension, and they continued to get health care benefits. But as lifestyles changed, and we weren't so healthy anymore, the cost began to spiral increasingly out of control. And now what we have is 80% of all the healthcare costs in this country, which is about $2 trillion a year, is now spent on chronic disease, which means that the diseases that kill us are not the infectious diseases that we fought 100 years ago. It's the diseases that we could prevent or cure if we essentially avoided three things: overeating, underexercising, and smoking. Now, it's not quite that simple, but frankly, those are the three behaviors that drive the greatest part of chronic disease. And so when you see that 80% of all those costs are going toward chronic disease, not really those things that just happen to us that we didn't expect or plan, it becomes evident that if we're really going to make a serious dent in both the economics as well as the lifestyle impact of health in this country, we have to change the system from one which is currently based on intervention to one that is based on prevention. And the current healthcare system says we will wait until you are catastrophically ill and then we will intervene, but the costs are going to be enormous. And when we incur those costs, they'll essentially be incurred by your employer. And you won't even know what those costs are, because you probably won't be a part of the negotiating process of being involved. Now, your employer will know. And your employer will be forced to try to figure out how do we increase your part of the cost or cut your end of the benefits, which is what happens in most companies about this time of year. The employees get a nice little notice that next year your premiums are going up X% and your benefits are going down by this. Is it because the company is cold and heartless? Yes, basically. No, it's not. Just seeing if you're still there. No, it's actually because the company is looking at the realities of the economics. One of the things that used to concern me, why don't insurance companies do more to cover wellness? Why don't they model what your company does? By the way, your company has a remarkable model here. Very few companies in America do what you do. I travel all the time, and anytime I find one like this, I take some notes and I make a mental note of it, I write some things down, and then I use you guys as an example in speeches to other companies when I talk to them about how can we transform the healthcare system. So you'll be an example from this point on, because I'm truly impressed with the extent of coverage and the extent of involvement that the company is willing to make in your lives to partner with you for better health. What happens, though, is that if the insurance essentially belongs to the company and the company gives it to you, in the days when you were likely to be insured to the same company in 10, 20, and 30 years, it made perfect sense that the insurance company would invest in your wellness. But here's what happens today. The average American changes jobs every 7 years. Now, it may not be true at the principal because you've got a pretty good gig. You may want to stay here a while. But you're not average. So the fact is, if an insurance company covers wellness programs, prevention-focused programs, the actuarial tables show that the real payoff for those programs comes in the outlier years, not in the upfront years. So it becomes pretty evident that if the company pays for you to be healthy later on, they're essentially spending money to make you less expensive to their competitor. Now again, we can argue whether that's a great thing or not, but it's a reality because business has to work to create a profit. And I think a lot of Americans just want to blame the insurance companies and say, why don't they do something differently? Well, one of the things we can do is to change the ownership of coverage so that you as an individual consumer actually own the coverage and it's more portable to you. And until that happens, it's going to be very difficult for us to change this model so that there's really a cost-efficient reason to invest in the wellness programs. Your company sees the value. They see it in immediate results in that for every person who exercises, every person who eats nutritiously, and every person who refrains from smoking, they have numbers that will show that you're not only less expensive to the company,